Hi, it's ABienvenu, and today we're going to talk about central lines. Um, we're going to talk about site access, the maintenance of them, and the purpose of central lines. So most patients that need central lines are for long-term therapy, whether it be long-term antibiotics, some chemo, uh, they don't have a port, so dialysis, um, or TPNs, because the central line is going to go directly into the heart, where the other ones, the TPN would burn the vascular. So this directly in the heart. So your first step, that's just a little kind of background. So one more other thing before I get into the patient's room, dressing changes. So the actual gauze dressing that's going to be on the out is going to be anywhere from 2 to 3 days. The clear dressing is roughly every 7 days, but if at any time the dressing looks soiled, or if it's visible, if it's loose, or it looks like it just needs to be changed, then we're going to go ahead and change it, because we really want to prevent any kind of infection. It's like a barrier in a sense, so we want to make sure that it's sealed at all times. So we walk in our room all the time. We make sure and wash our hands, make sure that we introduce ourselves so the patient feels comfortable. Who are we, and also we need to verify that this patient is who they are. So to do that, we can ask the patient to state their full name, date of birth, and verify it on their armband. So first off, I wash my hands. I'm gonna put on some clean gloves, not sterile. Even though this is a sterile procedure, certain parts of it. So to start, we are going to, put my clean gloves on, and I'm going to open my sterile, sorry, these gloves have been used. Alrighty, so we're going to open up the sterile kit now, and inside of it there's two masks, one for the patient, one for myself. So let's see. Clean gloves. We're going to open it away from me, okay? Right on top is right here, the patient's mask. So we're going to come right here and go to the patient, and if feasible, we're going to have to make sure that the patient is, if the patient can tolerate it. Obviously, if the patient's having trouble breathing, then we're not going to put a mask on to restrict the breathing. And so for the video purposes, we're going to have this here. And let's see, I'm going to do this. And we're going to do like this for a second. Yep. And obviously get it out of their eyes and whatnot. So it's on that as best we can. And so now this is still clean gloves. Your sterile field is here. Some packages, depending on the manufacturer, have a sterile field where you would open it up, make sure I'm touching the outside edges at all times, and never to go back and forth and cross-contaminate your sterile field. Maintain it's above waist height. You don't want to ever turn your back on your sterile field. So all this movement I'm doing here is just to focus my attention on the video, but in the clinical setting, never turn my back on the sterile field. So this package that we have doesn't have a sterile field, but it doesn't have a sterile field that we can make, but I'm going to treat it as if it is. So clean gloves. I'm going to start here, and I'm going to peel from the outer edges, holding the catheter, and just throughout the whole process, making sure that the patient knows what you're doing. They're not just jumping into it. And so Miss Sally, I'm going to take this off or whatnot. So I'm peeling all the outside edges off, right? Loosening up gradually and not just forcing it off. I'll peel everything off. I'm left with just this, the catheter itself. And so it's just a catheter here. And so I'm going to hold at all times. So I have my clean gloves, hold it here. And now I'm going to kind of just leave it before I completely feel it. Just hold it here take my clean gloves off. Now I'm going to don sterile gloves. Put my sterile gloves on. And let's see. Actually, I have, get my, touch the outside, take them off, open them up, making sure that I don't contaminate the gloves, okay? So taking the outside edges, and gonna put an extra large hand and a small today, without touching the edges. But for the video purposes, so I'm not sitting here for 5 minutes trying to fight it, I'm gonna touch it, okay? But in theory, you do not touch these areas here. Just for the video purposes, I am going to touch it just so we can move along faster and get these gloves on. So, get your sterile gloves on. Okay. One other step that I would like to add, before removing this dressing, there's a mask for myself that I need to have on before I remove the dressing. So the dressing it's not 100% off right now. I peeled up the edges, but do not continue without having your mask on because you don't want to contaminate that area. Okay, so put your mask on. Form fit it through your nose. And so this it's now I'm gonna pick a hand that I want it to be contaminated. One's gonna remain sterile, and one's gonna be contaminated. So I finished pulling off I'm gonna pick this hand here, my right hand, my dominant hand. I'm gonna keep it as gonna be the clean hand. So I remove the rest. I'm holding just the catheter now. So now this hand's sterile, my left. I have a chlorhexidine sponge deal here. And so you crack it and you squeeze, and you're going to let the solution fill up on the sponge. And the different, I don't know, medical professionals, they have their own different technique. So basically, you want to start closer here and gradually work away, okay? And each time you stick the sponge back down on the patient's area, like here, you're going to use a different part of the sponge. So in theory, you want to use the top, the side, the front, and move away from everything, okay? This one here, now it's done as trash. Sterile hand, left hand, you're gonna go back in your sterile field and get another one, crack, and now you're gonna work around the area, holding this at all times because you don't want that catheter to come out of its area. So you're gonna scrub a little vigorously with this one here now. It's a little stronger. Some evidence say that you can actually, with this step now, clean the certain leads that are coming down. Not the actual ports down here, but just the lines to make sure if there's anything on it. So now that is done, let's see, there is these alcohol swabs. The alcohol now, okay, let's see. So now this one here, the alcohol, you can clean around the area and let air dry all of this. Never try to fan anything because you can blow particles in there and bacteria and whatnot. So we're not going to mess with that. And we're going to let it dry. Still holding here. I have opened up this the new deal here. So just gradually hold here with your hands. I'm not going to open it because I don't want to waste it. So you peel across. Oh, that's a con. So holding it there, I can take here and come across. Now we're going to stick this directly on here. I'm not going to stick it on the mannequin because I don't want to mess it up. So we're going to stick it directly on there and seal it, making sure that there isn't any creases for things to travel through. We want to prevent that. We want to make sure that it's really flat and flush all around, all the edges. Also, you want to make sure when anytime working with this, the initial make sure looking for any drainages when you're cleaning this, or when you're just inspecting it. You want to make sure there's no drainages. You want to make sure redness, swelling, tenderness to the area. Again, your patient is the best one. They're going to tell you these things. They're going to say, oh, it hurts to touch or whatnot. You can visually see the redness or swelling or whatnot. So anyhow, it's my little soapbox, but we have the new dressing on there now. You want to make sure that you initial and date it, because then the next person coming through, they can see, okay, in 7 days, I need to change this. Okay, so that's this clear one. Some policies say that you have to have another dressing on top of this. It's a gauze dressing. So this is all sealed up, name, date. You have a gauze that just kind of goes right here, and you just tape the edges around it. Okay, these here, the maintenance of these, you want to make sure some is per facility policy or whatnot, but you take your flushes. I know Regency and Forest General, it's every shift, so every 12 hours you take a flush, and each one of these you flush the lines to make sure they're patent, because I'd hate to get in a predicament where you want to go and push medicine through it and it not work or to be occluded. So just the maintenance, we're going to make sure and unlock it, obviously, flush the line, and just make sure the upkeep on it. Again, that was a pretty quick run through of this here. Make sure you can take your patient mask off of them now. You can take your gloves and take your stuff off. But throughout this whole thing, make sure and note, again, any redness, swelling, tenderness, discharge, anything like that, and document it in the patient's chart, and the upkeep, flushing these lines, really important. Like I said, again, if you go to use it and it's there, but it's occluded, it's no good. So make sure and do that every shift. The gauze dressings every 2 to 3 days, reiterating that, and the clear dressings every 7 days. And make sure and date it, because it's pointless if it's up there, but who knows how long it's been on there. And that is it. All right. Thank you so much.